Hi, this is Brian Bartlett, the Relocation Program Manager here at Fort Riley, Kansas, home of the Big Red One. Hey, we're back here today at Irwin Army Community Center, Community Hospital, because a lot of people have asked all about the physical therapy and all the other different kind of therapies we have here to offer you guys. So we're back here again to show you what we have to offer. So, on with the show. Okay, so Sergeant Baham here is going to demonstrate to Tyler, talk to Tyler through this new apparatus.
Alright, so he's in this anti-gravity machine, right? What it does is it reduces body weight, so this soldier can get back to PT tests, back to unit life. Right now he's running at 70%. He puts his shorts on, gets in here, and he can change the inclination and the speed for the treadmill inside of here for the anti-gravity machine. So this machine, he's using 70% of his body weight. So eventually we get him to 80% body weight, and then 90% body weight, and then once he graduates from here, once running with more of his body weight becomes more comfortable for him, we can put him on a treadmill, and we can progress him from the anti-gravity machine into a walk-to-jog program outside of here so he can get back to his unit.
Good morning and welcome to Irwin Army Community Hospital Physical Therapy Clinic. I'm Lieutenant Scozz, one of the staff physical therapists here at the Physical Therapy Clinic. I want to take this time today to talk to you a little bit about what services our physical therapy clinic has to offer. We treat a variety of musculoskeletal conditions ranging from the common sprained ankle to post-operative care for patients who've had surgery. So typically the process to get into the physical therapy clinic to be seen by a therapist includes going to your primary care manager and then getting a referral here. We also do have direct access to care, meaning that patients can self-refer themselves, but oftentimes it's a lot easier to go through your primary care manager to assure that there's nothing else that they can do on top of the rehabilitation aspect of it. We have a lot of services here, as you can see, and a lot of great tools to allow our patients to rehab in the best possible way. Some of our very interesting new technologies include the Ultra G, which Sergeant Baham talked to you about earlier. We also have a bunch of other equipment that we can use to optimize our patient outcomes.
Okay, so what you can't see, because we can't show you this, is this place is actually full of soldiers right now getting treated. All this equipment is all for these guys to utilize.
Another thing that we want to start focusing on in our therapy is coming up with long-term goals in our rehabilitation progression tailored towards the events on the new Army Combat Fitness Test. So right here, Sergeant Baham is performing the deadlift with correct form in the hex bar, which our soldiers will have to start doing around 2020.
Good morning, my name is Susan Cullen and I'm the speech-language pathologist here at Irwin Army Community Hospital, specifically within the TBI clinic. I'm fortunate enough to work closely with occupational therapy, physical therapy, which you saw earlier, and occupational therapy, which you will learn a little bit more about. I just wanted to highlight a couple services here that we offer within our clinic in case you're suffering or have any issues with memory, speech, so including like word finding, can't thinking what you want to say sometimes, have difficulty getting those words out, or maybe you're noticing that you're forgetting more things than you have ever before. Whether it's a sudden onset or more gradual, here are some of the things that we can kind of offer to help you out. As you can see, she is doing a cognitive puzzle. We also have some available services for you, including to help with remembering to take your medications on time, whether that's giving you things like a pill box, which we have, whether you go to the VA, us, or are currently in WTB, more of those automated services to help you remember when to take your pills. There are a lot of compensatory strategies out there that we can offer to set up with you. You may have heard advertised the LiveScribe pen, which is a recording device that we can also help you with if you are a candidate, and it literally records stuff for you. So whether you're a student in school, looking to go back to school, or an employee who maybe is not having able to keep up with remembering everything from meetings. So these are just some of the things that we can kind of work on in cognitive therapy, in addition to OT and PT. Nice job.
Thank you.
Hi guys, it's Susan again from the TBI Clinic. I'm going to work with Lieutenant Scoz to show you one of the things that you will commonly see here done daily at the TBI Clinic in conjunction either with PT or OT here. We are going to be delving into ball of physics, which stands for balance, auditory, vision, and it helps with a wide variety of patients, whether you have balance issues, maybe some vision issues, or even attention issues. We work with a wide variety of ages. So either school age all the way till adults, veterans, and the WTB service members as well. We'll just jump right in and kind of show you how just working with some simple bean bags and just these small green, white, and yellow balls, as well as using some balance boards, can kind of help train the brain to focus more by working on some cross-lateral movements. So, are you ready, ma'am?
I'm ready.
All right, so we're just going to jump right in and focus on just kind of bouncing it down, almost like a basic pendulum, really. You're a quick learner, so it's up to you. Would you rather do the balance board next or the square?
Balance board.
All right, so hop on. And as you can see, she's bouncing it very particularly. She's bouncing it down, you're doing it yourself, down and up. She's bouncing it with her palm out, and she's catching it with that auditory. That auditory feedback is amazing because it helps kiddos and adults, especially our veterans and active duty service members that might be experiencing some PTSD. So if you have any of that problem with attention, concentration, whether it's in school, whether it's in daily life, whether it makes kind of going into stores more difficult, just a simple movement can really help you focus on things. Is it easy, medium, or hard? Hard. But I've also got you on the balance board. So hop off of that if you don't mind, which is a more complex task, right? So you can also pair this with using up to 1, 2, 3, 4. A lot more people can do this. We've had gymnasiums full of people doing this. So we're just going to show you a simple pairing exercises with partners. We will all throw the ball the same way. We've got the same kind of grasp and release concept going on. And we're going to work on balance and coordination. And you will see the way that Lexi and I throw the ball and cross over midline. It kind of gets the left and right sides of the brain talking to each other a little bit more. So it's really helpful. And we found a lot of success with our patients with concussions. Now, if you're wondering, well, do I need this? Is it right for me? That is a great question to ask your primary care doctor on your next visit. Some symptoms that patients, or you, sorry, I just kept going, it's okay, might be experiencing, in all honesty, could be difficulty with attention, okay? More fatigue, problems concentrating. You might be having a harder time in school, more headaches, whether those are just headaches or migraines. If you've been in a car accident, if your doctor's actually told you that you've had a concussion, a traumatic brain injury, if you've had more dizziness, balance issues, problems with vision, those are all things, especially if they're coupled with changes in your sleep or insomnia, that you're going to want to get checked out by your doctor, and then maybe go ahead and ask for that referral to our TBI clinic.
Okay, so that concludes our video today. I want to thank Lieutenant Scoz, Susan, and Sergeant Baham for letting us come down here today and demonstrate all these different things that you have, options that you have coming here if you need physical therapy or any other type of therapies they offer here. So, I want to throw a real quick shout out to all our first responders that keep Fort Riley a great place to live, train, deploy from, and come home to, where there is no mission too difficult or no sacrifice too great. Duty first.